Thank you so much for the opportunity to be part of today's program. Many of you will know that Jamie and I have been closely associated with Dental Health Services Victoria for a lot of years. Today we come as co-conveners of the Oral Health Special Interest Group of the Public Health Association of Australia. But I want to make a few comments first on how dental care is out of reach for too many people in our community. The Public Health Association is committed to universal and equitable access to dental care for all within Medicare. Now that's an easy answer as to how to get dental care to everybody. Easy to say, but difficult to achieve. Why is it that everybody can't access dental care when they need it? The dental workforce is expanding, with many providers either unemployed or underemployed. Yet, we here in this theatre know that there is just so much untreated disease. For as long as I've been an observer of the dental system, and that's some 40 years, I have been burdened by its failure to make care accessible to all. Should we just wait for governments to introduce a Denticare scheme? You can all answer that one for yourselves, especially since last month's budget. But I think we'll all die waiting. When I was young, I lived in a fast food shop. We sold fish and chips. We also made hamburgers. Not many. The demand was not high. But people loved them. Then an American company turned up. It provided a low-cost burger. Nowadays, the market is huge and franchise holders live comfortable lives. Everybody can afford a hamburger. Now, it's a bit politically incorrect as an analogy, especially following Jane Martin. But it illustrates a simple truth. By changing the way hamburgers were offered, everybody could afford them. And what was the vehicle used? Lower prices and some other cheap tricks as well. Is there a message here for us? Is there a model of care that can make dental care within reach of everybody? If such a model doesn't exist, can we, in this room, begin the search for it? After all, we've all signed up to be part of the health system. Most of us in this room are health professionals. Others are administrators, some policymakers. And those of us who are health professionals have a high duty to heal the sick. That's an old-fashioned way of describing what you do. But isn't that the essence of the role? Those of us in administration and policy making have a duty too, to develop systems that enable everybody to get a service when they are sick. And we know that there is just so much untreated disease in the community. Why have we been so tolerant of the lack of access to the healing powers we have? When will we say enough is enough? Each of us needs to take on this issue. For some of us, it might just mean upping our productivity by making all of the hours available to offer service get used most effectively. To administrators, I say, have we made sure our systems support greater productivity? Have we minimised our costs? To policymakers, are we worried about the extent of untreated disease? Have we looked at other systems? If we were starting again, How would we design a dental care system? And if you feel that it looks too hard, let me encourage you to look outside the square. In all of the study I've done in my life, the subject I have loved most was entrepreneurialism and innovation in an MBA course. Such subjects exist everywhere to help people to bring fresh eyes to problems that we have to solve. Governments make policy and develop programs because there is a problem in society that remains unsolved. Dental Health Services Victoria exists to provide and coordinate care for those who cannot afford care elsewhere. We are here to solve a problem, not just to provide care, but to help get a system that is in the reach of all. Who will sign up to solving this problem of access? Now, our Oral Health Special Interest Group invites you to take on this challenge. And Jamie's going to join me now to
Victoria was the dental hospital. My final employer in Victoria, at least I think it's my final employer, is the brand spanking new organisation called CoHealth in the bright and shining West. And so I thought that the theme of today was the changing face of dentistry, and I thought that actually referred to me over 40 years of working in Victoria here. But I believe it's not all about me at all. The Public Health Association of Australia, PHA, refers, the P is more for population health. It's not the relatively small public sector within dentistry. So it's population health of Australia. And it's an umbrella group, and within it there are many special interest groups, of which oral health is one. It accepts anyone as a member. You just have to show an interest. And the PHA is a forum for advocacy, it's a forum for policy development, and it's a forum for education. You get a brand spanking, clean, glossy magazine 4 times a year, which covers all sorts of things about diabetes in the Kimberley, or smoking among Maoris in North Island, or all manner of things in between. So it's open to all. You can be right-wing, you can be left-wing, you can have no wings, you can even be Scottish National Party, and who knows what they stand for. So we're looking for membership. The Victorian branch, the activity of it has been suboptimal of late, and we want to increase the participation. And I'm sure that within a room like this, there must at least be half a dozen people who really want to think about policy and advance the cause of oral health. We're looking for a cohort of people who will have a good voice. We're looking for the next generation of Deb Coles. We can't have enough Deb Coles. It's too late for Shane Maguire and myself. But within this body, there must be younger people who are working up the ladder of their own career, and we need people as dynamic as Deb. So we want to advocate membership. I, believe it or not, I've got membership for application forms. There are 3 levels of membership according to your income. There's even an associate membership, which doesn't give the magazine. You don't get the glossy, but you get the warm inner glow. And today I'm suggesting that not just OSIG, we would encourage, if you don't want to spend a razoo, if you don't want to join anything, get in touch with, well, not so much them, but now, can we see the previous slide? I made up 2 wonderful slides, this one and that one. if you bombard Natalie and I, we are launching FUSIG, Friends of the Oral Health Special Interest Group. So you don't even blooming well have to be a member, but I really would suggest that you do become a member. So at the end, when we're outside, rush us for an application form, and we'll be delighted to let you join the ranks. Thank you.